She attached it to one of the syringes and then filled it with the sedative lidocaine. While the team checked her vitals, she jabbed the needle into her right breast a few times, pumping a little of the anesthetic to deaden the region around the lump as best she could. Then she took the other needle and syringe and plunged it in, piercing skin and connective tissue until she could feel the resistance from the small tumor. She then jabbed the lump and pulled back on the plunger to extract as much material as possible, which was then sent off to be analyzed. Unfortunately, when the sample returned from the lab, it was the worst news she could have possibly gotten, which was that it was inconclusive. Their equipment was too old to say whether she had cancer or not, so she contacted the US again for more help and a new plan. It didn't take long to come up with one, but they knew that landing a plane at that time of year was too dangerous. However, they had done emergency drops in the past. Although it was too dark and too cold to land, a pilot could still fly to the South Pole and follow the ring of fires that staff had lit outside the station. Once spotted, they'd drop the supplies down on parachutes. So on July 11th, a US military aircraft flew out of Christchurch, New Zealand with better testing equipment and medical supplies, including chemotherapy drugs. Once the cargo was recovered, a new test was done and it turned out that she needed the medication after all. Jerry had an aggressive form of breast cancer and she still had months to go before she could reach a hospital. The US government immediately started to work out how to get her home early, but the best they could do was the beginning of October. In the meantime, Jerry returned to her small medical team and taught them how to administer chemotherapy so she could begin treatment while waiting to fly.